Here we're going to investigate arthritis. Now, while this is a general term that you may have heard of before, we're going to focus in this video lecture on two main different types or classifications under the large branch of arthritis. So, in general, arthritis is an inflammatory and degenerative disease. There's more than 100 different types of inflammatory or degenerative diseases that damage joints. Arthritis is the most widespread and crippling disease in the U.S. Symptoms are pain, stiffness, and swelling of a joint. Acute forms are caused by bacteria and treated with antibiotics. So it's important to keep in mind that while we have this general term, there's actually a lot of subsets and a lot of different types of arthritis. So what works for one person may not work for another. Two chronic forms that we're going to focus on here include osteoarthritis and rheumatoid arthritis. Starting with osteoarthritis, which I'll abbreviate O, capital A, is the most common chronic arthritis. It's often called the wear and tear arthritis. It affects women more than men, and about 85% of all Americans will develop some form of osteoarthritis. It's more prevalent with the aged and elderly, and it's probably related to the normal aging process. So just to give you an idea of what a normal hip joint would look, nice and smooth, that cartilage there allowing these gliding motions between these two bones articulating. Here we have exposed bone, we have that breakdown of that worn cartilage. This is an example of osteoarthritis. The course of an osteoarthritis, again we see a picture of a nice normal knee, nice smooth, shiny look, and then the osteoarthritis, that breaking down of that cartilage. Osteoarthritis reflects the years of abrasion and compression that's caused by increased production of a malloproteinase enzyme that breaks down cartilage. As one ages, cartilage is destroyed more quickly than it's replaced. The exposure of bone ends thicken, enlarge, form bone spurs, and restrict movement. Joints most affected are cervical and lumbar spine, fingers, knuckles, knees, and hips. So you can kind of see the purple regions located here are areas that tend to be most affected by osteoarthritis. Treatment for this particular issue, sadly this is a slow progression and also irreversible disease. There are some potential treatments, and they include mild pain relievers, magnetic therapy potentially, glucosamine sulfate decreases pain and inflammation. In extreme cases, you may have known someone that's gone through what's called joint replacement. They're actually replacing a portion of that joint and removing that damaged area and replacing it with, in this case, usually a titanium or some sort of synthetic product to replace that joint with. In this example here, we see total knee replacement. This would be an example of the femur or a hip replacement. It can also occur in small areas, such as the fingers. Rheumatoid arthritis is the other type, and this is abbreviated RA. This is chronic inflammation autoimmune disease of unknown cause. Usually this occurs between the ages of 40 and 50. However, it may occur at any age. What we're seeing in this image here are a normal joint and that nice smooth appearance. And here we're seeing that joint affected by rheumatoid arthritis. We're still losing cartilage. We have this inflammation. We could have bone loss, all other negatives that could occur. Signs and symptoms include joint tenderness, osteoporosis, muscle atrophy, cardiovascular problems. All these can be related to rheumatoid arthritis. The course of rheumatoid arthritis is marked with exacerbations and remissions, kind of this boom and bust. The key part here is that it is an autoimmune disease. The course already begins with the inflammation of synovial membranes at the affected joint. Inflammation of blood cells migrate to the joint, causing swelling. The end result, we could produce deformed fingers in extreme cases. So again, because it's an autoimmune disease, the immune system is involved. Here we have B cells and T cells of our immune system being brought to the area. We have this kind of reaction that's basically occurring. And this occurs in rheumatoid arthritis. Now, rheumatoid arthritis, some treatment. There's many different potential options. There's conservative therapies such as aspirin or long-term antibiotics. There's progressive treatments for anti-inflammatory drugs. And there's some other biological response modifiers that neutralize the harmful properties of those inflammatory chemicals. So because it's autoimmune, different things may work better for different people. Now comparing the two, rheumatoid to osteoarthritis, is a great chart that tries to put some of the features in a comparison. Age of onset, rheumatoid can happen at any age. Osteoarthritis usually later in life. Rheumatoid's a very rapid onset. Osteo is a very slow, occurs over years. Again, because it's autoimmune, it can occur very quickly. Distribution, joints affected, duration, and kind of your symptoms. Osteoarthritis, because it's not an autoimmune disease, because the immune system's not involved, there's really no systemic symptoms involved. However, rheumatoid arthritis may come about with fatigue, fever, and night sweats. So just being able to kind of compare some of the two, while they both fall under the classification of arthritis, you can see there's some clear and distinct differences between these two. And these are just kind of the two chronic ones I chose to compare for the purpose of this video lecture.